Are you struggling to control your cholesterol levels? Alirocumab might hold the key to unlocking a healthier heart. Join us as we delve into the fascinating mechanism of action of this groundbreaking medication. Understanding cholesterol and its impact on health. Cholesterol is a waxy substance that is essential for the normal functioning of the body. It is necessary for the production of hormones, vitamin D, and bile acids that help digest fats. However, high levels of cholesterol can lead to the buildup of plaque in the arteries, which can increase the risk of heart disease and stroke. There are two types of cholesterol: LDL cholesterol, low-density lipoprotein, also known as bad cholesterol, and HDL cholesterol, high-density lipoprotein, also known as good cholesterol. LDL cholesterol can build up in the arteries, while HDL cholesterol helps remove LDL cholesterol from the bloodstream. The role of PCSK9 inhibitors in cholesterol control. PCSK9, proprotein convertase subtilisin, Cushing type 9, is a protein that plays a key role in regulating LDL cholesterol levels. It binds to LDL receptors in the liver, preventing them from removing LDL cholesterol from the bloodstream. PCSK9 inhibitors are a new class of medications that have been developed to target PCSK9 and lower LDL cholesterol levels. These medications work by blocking the action of PCSK9, allowing more LDL receptors to remove LDL cholesterol from the bloodstream. How alirocumab works: inhibiting PCSK9. Alirocumab is a PCSK9 inhibitor that works by preventing PCSK9 from binding to LDL receptors in the liver. This means that more LDL receptors are available to remove LDL cholesterol from the bloodstream, effectively reducing its levels. In addition, alirocumab helps to increase the liver's ability to remove LDL cholesterol. This is because when PCSK9 is inhibited, the liver produces more LDL receptors, which in turn increases the liver's ability to remove LDL cholesterol from the bloodstream. Clinical trials and evidence supporting alirocumab's efficacy. Numerous clinical trials have been conducted to evaluate the efficacy and safety of alirocumab. One of the most significant trials was the ODYSSEY Outcomes trial, which involved over 18,000 patients who had experienced a recent heart attack or unstable angina. The trial found that patients who received alirocumab had a significantly lower risk of major cardiovascular events, such as heart attack, stroke, and death from cardiovascular causes, compared to those who received a placebo. The results of this trial have led to the approval of alirocumab for use in patients with established cardiovascular disease. Benefits and potential side effects of alirocumab. The main benefit of alirocumab is its ability to lower LDL cholesterol levels and reduce the risk of cardiovascular events. It has been shown to be effective in both primary prevention, for patients without established cardiovascular disease, and secondary prevention, for patients with established cardiovascular disease. However, like all medications, alirocumab can have potential side effects. The most common side effects include injection site reactions, such as pain, swelling, and redness. Other less common side effects include flu-like symptoms, such as fever, headache, and muscle pain. Dosage and administration guidelines for alirocumab. Alirocumab is administered by subcutaneous injection once every 2 weeks. The recommended starting dose is 75 mg, with the option to increase to 150 mg if further LDL cholesterol reduction is needed. It is important to follow the dosing and administration guidelines provided by your healthcare provider to ensure that you receive the full benefits of alirocumab while minimizing the potential for side effects. Comparing alirocumab with other cholesterol-lowering medications. There are several other medications that are commonly used to lower LDL cholesterol levels, including statins, ezetimibe, and bile acid sequestrants. Statins are the most commonly prescribed medications for lowering cholesterol levels and have been shown to be effective in reducing the risk of cardiovascular events. However, some patients may not be able to tolerate statins or may not achieve adequate LDL cholesterol reduction with statin therapy alone. Ezetimibe is another medication that works by inhibiting the absorption of cholesterol in the intestines. It can be used alone or in combination with a statin. Bile acid sequestrants are medications that bind to bile acids in the intestines, preventing them from being reabsorbed into the bloodstream. This leads to increased production of LDL receptors in the liver, which in turn leads to increased removal of LDL cholesterol from the bloodstream. Patient experiences and success stories with alirocumab. Many patients who have used alirocumab have reported significant improvements in their cholesterol levels and overall cardiovascular health. One patient, Jane, had struggled with high cholesterol for years despite taking multiple medications. After starting Alirocumab, her LDL cholesterol levels dropped dramatically, and she was able to reduce her other medications. She reported feeling more energetic and having a greater sense of well-being. Another patient, John, had experienced a heart attack and was at high risk of further cardiovascular events. After starting Alirocumab, his LDL cholesterol levels dropped significantly, and he has not experienced any further cardiovascular events. Conclusion: the future of Alirocumab in cholesterol control. Alirocumab is a groundbreaking medication that has the potential to revolutionize the way we manage cholesterol levels and prevent cardiovascular disease. Its mechanism of action is unique and highly effective, and it has been shown to significantly reduce the risk of major cardiovascular events in patients with established cardiovascular disease. As more research is conducted and more patients have access to this medication, we can expect to see even greater improvements in cholesterol control and cardiovascular health. If you are struggling to control your cholesterol levels, talk to your healthcare provider about whether Alirocumab may be right for you. Remember, managing your cholesterol levels is an important step in maintaining your overall health and reducing your risk of cardiovascular disease. With the help of medications like Alirocumab and lifestyle changes such as diet and exercise, you can take control of your cholesterol levels and unlock a healthier heart. Thanks for watching.